Malaria has plagued humanity since ancient times and continues to haunt 40% of the world's population, infecting more than 500 million people per year and killing over 1 million people.
Malaria has been one of the major problems, health problems we've been facing in Kilifi over the time, for a long time actually. Kilifi being a malaria endemic zone, it's been the leading cause of both morbidity and mortality in Kilifi. But interestingly, over the past few years, about 3 years or so, we've been seeing tremendous decline in prevalence rates, which has moved from around 35% to currently now we are doing about 30%. Subsequently, it has also now reduced from being the leading cause of morbidity or causes of admission in our hospital to actually being the number 2 cause of admission now.
Malaria is one of the top 10 diseases. Of course, it's the leading even than even HIV/AIDS. And the most affected groups are, of course, children under, especially 1 year, but probably under 5 years, and expectant mothers. But all the population is also affected by malaria.
In Kenya, malaria continues to be the leading cause of morbidity and mortality, with 25 million out of a population of 34 million Kenyans being at risk of malaria. It accounts for 30 to 50% of all outpatient attendance and 20% of all admissions to health facilities. It is also estimated to cause about 20% of all deaths in children under 5. Economically, it is also estimated that approximately 170 million working days are lost to the disease each year.
Ndugu ya baba yangu alikufa mwaka uliopita na mtoto wake pia akafuata.
The government has made efforts to curb the disease through adoption of key strategic interventions in the fight against malaria.
Malaria has been a big challenge, but at least we are happy that in the last 4 years we have had a massive scale-up of effective malaria control interventions, and we are now seeing a positive impact on the health. We've had a very successful insecticide-treated net program. We've also had a very successful adoption and implementation of the new malaria treatment policy. And we've also now scaled up indoor residual spraying activities. And the evidence we have is that we are now reducing the number of malaria cases in this country. The report from the Kenya National Bureau of Statistics showed that between 2006 and 2007, there was a 13% reduction in the number of malaria cases.
Right now, according to the government policy, the ACT drugs are supplied to all the health facilities and mission hospitals in the area. So the drugs are given free of charge to all cases that are reported to be having malaria.
We have a program running, although it has not been running for the past 4 months or so, whereby we've provided our patients with the mosquito nets, the ITNs. This has been attributed to the reduction in the malaria cases that we see in the hospital.
All patients get health education, both in the departments, that's the inpatients and outpatients, and those who come to the hospital. When the nets were available in the hospital, we advised each one of them to carry a mosquito net with her. That is in all the departments.
Mwanzo wa mwaka tulipata hizo nets long lasting, na tulienda huko kwa Kinjinji kuhamasisha watu, na tuliwasaidia sana, especially watoto wa miaka 5 kurudi chini na kina mama wajawazito. Hao walipata neti kwa wingi sana na walifurahi sana, lakini hazikutosha kwa sababu watu ni wengi na neti zilikuwa tu si nyingi sana kwa vile kama vile tulikuwa tumetarajia.
The combined forces that we are doing actually with the collaboration with the Ministry of Works and other stakeholders, we are seeing that it can be eradicated even right now, we have integrated things like larviciding as well. And what is coming up is that it is slightly now coming down.
Another very important aspect is information, education and communication to better arm the public with malaria preventive and treatment knowledge and inform all malaria partners to instill uniformity in the messages disseminated to the communities.
Actually, the main thing which we actually think we believe has led to the decline into the incidence and prevalence of malaria is actually the public health intervention that we've had for control of malaria. One, basic education in the community to educate people on how to clear out the breeding sites for mosquitoes, which we know are the leading or are the transmitters of malaria. But more importantly is the mass distribution of nets that has happened over the past few years, and especially now with the inception of the free net distribution policy to the pregnant population and the children under 1. We've seen a lot of nets actually distributed out there in the community, and the utilization also is quite high at the moment.
Wakati wa mbeleni nilipokuwa hatujaanza kutumia hizi net, katika nyumba yangu kulikuwa kuna malaria ambayo ya mara kwa mara na tupelekana hospitali, lakini kutoka tuanze kuelimishwa juu ya mambo ya neti, naona mambo ya malaria nyumbani si mbaya sana, inaendelea vizuri.
Malaria is a disease that is treatable by following the lay down rules, whether it is by using nets, spraying, and also if somebody is sick, providing treatment. So I have seen there's been a decrease of malaria cases in this region.
There is also need for monitoring and evaluation and operational research that is used to provide reliable information on progress in controlling malaria.
It's been shifting. Of course, we normally associate, and in fact even the public associate it with the seasons, the rainy seasons. Actually, we see peaks during the rainy season, but you see those seasons keep on shifting from one year to year. But generally it ranges between the month of March to around June, and then towards November to December every year.
The resources are not enough, because actually there are some things that we still have to collaborate with other partners.